Hi, I'm Jen Dyer. You can find me on Twitter as Indo-Goddess. I made up that name because everybody calls their diabetes doctor, and well, who's an endocrinologist, they say, who's your endo? So, and I'm into fashion, so I just said Indo-Goddess. But I started out college as a journalism major. I was too afraid to become a doctor, and then I realized I was tutoring people in my dorm with chemistry and thought, well, maybe I could do it. So I actually was a journalism major, and I went to medical school. And I was going to be a journalist if I didn't get in medical school. So I went to medical school, and I was really dedicated to wanting to be a clinician 100%. And I really did want to do endocrinology because I like chronic care, and I really like getting to know my patients really well, and I thought it was one of the more happy ending of fields. Diabetes isn't happy, but it can be managed, and I felt that that was really empowering, and I was just drawn to it for that reason. In my fellowship, I still was going to be very clinical, but we had to do research, and I ended up being very successful with my research because I did choose something I was passionate about, which is the developmental origins of disease and preventing disease during pregnancy by what you eat. Because if pregnant women eat certain amounts of carbohydrates and their blood sugars spike up, it actually can imprint on the genes. And I thought that that's something that I could help. I'm really into food and cooking and such, and thought, well, that just makes sense to me. So I started out my career as a researcher and a clinician, so a clinician scientist. And I got my master's in public health, and that's where I really started my social media journey with health literacy and writing and combining a lot of things, creative things that I like to do. I've just found myself drawn to it. For one of my practicum projects with my master's of public health, I started writing online as my project and got lots of hits. Actually, my piece from 2007, HPV vaccine, was recently circulated with recent debates and such. And so I found there was a lot of power in that. And I went to a medical communicators conference where Brian Vardavidian, who I actually knew before from pediatrics, he's Dr. V on Twitter, was trying to talk about Twitter and why should people be on Twitter. And this conference is usually about teaching people, physicians, about how to communicate on camera and how to communicate their message better on TV. And so this was a social media arm, and he was talking about that there are 60,000 members in the American Academy of Pediatrics. And if one member said something online once a year about vaccines and autism, that would override the search engine optimization, so that when a new mom is looking at vaccines, that she's going to see a lot of science as the first 3 pages of Google, and think that what her doctor is saying is going to be more truthful because it comes up first in the Google search. So I thought that was a powerful argument, and I had a mobile phone, so I just found myself, I named myself Indo-Goddess in April of 2009 at that conference, and we all followed each other in that room. And then I went to the airport, and I was bored, and I saw this woman with hypothyroid, because any doctors are sitting in the airport, people watching, I can't help myself with diabetes. So I saw that this woman had hypothyroidism, and I just thought, should I tell her or should I not tell her? So I said that on Twitter, and some people said, oh, you should tell her, or some people said, don't tell her, that's embarrassing. So I kind of engaged Twitter in that sense. Maybe it's just my personality's natural for that, because I get bored and I just think all these things. So, but it just kind of evolved from there. And I've also found myself in mobile health, texting my teenage patients with diabetes and improve their health outcomes. And now I've made an app for diabetes and am an app developer and full-time technology entrepreneur. So I've left practice, but social media was really my first step into that field, and I think there should be some more social media in mobile health, and it still is health literacy. And I'd say public health is really what I'm drawn to with social media. So that I pass.
Hi everyone, my name is Matt Katz. I'm coming from